Hey guys, this is Dr. Hub. Today we'll look at the antineoplastic drugs. So antineoplastic drugs, and in this we will be looking at the classification. So looking at broadly, the antineoplastic drugs is divided into the non-cell specific, and then comes the cell specific. Now let's see what is under the non-cell specific. So under the non-cell specific, it includes the alkylating agents. There is alkylating agents, and what does the alkylating agents include? There is presence of the nitrogen mustards. Then there is also the nitrosurias. Then comes the presence of triazines. There is presence of triazines, then ethylenamines, as well as the presence of the alkyl sulfonates. Then what are the other components of the non-cell specific? It includes the platinum compounds, as well as the presence of the anti-tumor antibiotics. So next, broadly we'll look at the cell specific, cell cycle specific. So under the cell cycle specific, there is a S phase inhibitors. So under the S phase inhibitors, it includes the anti-metabolites. It includes the presence of the anti-metabolites, and there is also the presence of the topoisomerase. There is topoisomerase inhibitors. Next, there is also the hydroxyurea. There is presence of the hydroxyurea. Next is the histone deacetylase inhibitors. This is histone deacetylase inhibitors. So this was about the S inhibitors. Next, let's look at the M phase inhibitors. So the M phase inhibitors, it includes the vinca alkaloids. Let's write it fresh. So in terms of the M phase inhibitors, it includes the vinca alkaloids. Then comes the presence of the taxanes, and there is also the epothiolons. Next comes the eribulin. There is presence of the eribulin, and then there is also the estramustin. So this was all about the broad classification. Now let's look in detail. So first, under the non-cell specific, non-cell cycle specific. So under the non-cell cycle specific, we look at the alkylating agents. So under the alkylating agents, it includes the nitrogen mustards. There is presence of the nitrogen mustards. So under the nitrogen mustards, there is the cyclophosphamide. There is presence of cyclophosphamide. Then there is also presence of the ifosfamide. There is cyclophosphamide. There is ifosfamide. Next, there is mechlorethamine. There is mechlorethamine. Then there is also presence of the melphalan, and there is also the chloramphenicol, chlorambucil, and the bendamustine. mustin. Then we move on to the nitrosurias. So under nitrosurias, this includes the presence of the carmustin. There is carmustin. Next, there is also the lomustin. There is carmustin, there is lomustin. Then there is also presence of the semustin and the streptozocin. There is streptozocin. Next, we look at the triazines. Under triazines, there is the methylating agents. It includes the methylating agents. So what is the methylating agents including? So it includes the procarbazine. There is procarbazine, as well as there is presence of the carbazine, and there is also the temozolomide. This temozolomide. Then the other heading will be the ethylenamines. So under ethylenamines, it includes the oltretamine. There is oltretamine, and there is also the TEPA. Next heading will be the alkyl. It's going to be the alkyl sulfonates. So under alkyl sulfonates, it includes the bulsulfan. Next, we move on to the platinum compounds. So under the platinum, let's write platinum. Under the platinum compounds. So platinum compounds, it includes the cisplatin. Next, there is also the carboplatin. There is carboplatin, as well as there is presence of the oxaliplatin. Next, we move on to the anti-tumor antibodies. So under the anti-tumor antibodies, it includes the anthracyclines. So under anthracyclines, there is the presence of the doxorubicin. There is a doxorubicin, and there is also doxorubicin. What do you mean by doxorubicin? It includes the adriamycin. Then there is also the daunorubicin. So under daunorubicin, that is nothing but the rubidomycin. That is nothing but the rubidomycin. Next, there is the epirubicin. Then comes the valrubicin. There is valrubicin, and there is also the mitoxantron. So what are the other drugs? The other drugs, it includes the actinomycin D. So that is nothing but the dactinomycin. Then there is also presence of the mitomycin. So the mitomycin is mitomycin C. Then comes the presence of the bleomycin. This bleomycin, and it is also a G2M. It is a G2M phase inhibitor. Next, we move on to the cell-specific drugs. So what do the cell-specific drugs include? So this includes, there's a S-phase inhibitors. So under the S-phase inhibitors, what are they? So it includes the antimetabolites. So how is the antimetabolites? Under antimetabolites, there is the antifolate. So under antifolate, it includes the MTX, that is a methotrexate. There is a Pemetrexed. Next, there is also presence of the pralatrexate, and there is also the raltetrexed. Next we move on to the purine analogues. So under purine analogues there is a 6-MP. MP stands for the mercaptopurine. There is also the 6-thioguanine. And there is also the fludarabine. There is fludarabine. And there is also the cladribine as well as the pentostatin. Next we look at the pyrimidine analogues. So under pyrimidine analogues, it includes the 5-fluorouracil as well as the capecitabine. Then there is also the gemcitabine as well as the citarabine. Lastly, we move on to the topoisomerase inhibitors and the histone deacetylase inhibitors. So under the topoisomerase inhibitors, so they include the 1 and 2 inhibitors. So topoisomerase 1 inhibitors, so this includes the irinotecan as well as the presence of the topotecan. Next, moving on to the 2 inhibitors. The 2 inhibitors, it contains the etoposide. There is etoposide as well as the teniposide. Then we move on to the histone deacetylase inhibitors. So under histone deacetylase inhibitors, so it includes the varinostat. There is varinostat as well as presence of the belinostat. Belinostat and varinostat are part of the histone deacetylase inhibitors. So what are the other drugs? Other drugs can also include the hydroxyurea. Then finally we move on to the heading of M-phase inhibitors. So M-phase inhibitors, it is nothing but the antibiotics. This is the antibiotics or the microtubule. It is a microtubule or the antibiotics damaging agents. So what are present under the M-phase inhibitors? So this includes, there is vinca alkaloids. There is vinca alkaloids. So vinca alkaloids are nothing but the vincristin. Vinca alkaloids are nothing but vincristin. That is the oncovin. Vincristin, that is a oncovin. Next, there is also the presence of the vinblastin and also the vinorelbin. Next, looking at the taxanes, there is presence of the paclitaxel, then there is docetaxel as well as the cabazitaxel. So what are the other drugs? There is the presence of the epothelions, eribulin as well as the estramustin. Next we move on to the G1S phase inhibitors. So under the G1S phase inhibitors, this includes the epipodophylotoxin. So this epipodophylotoxin.